Going to start by showing you this is the remote to my phone. I just started the recording. My name is Jennifer Caldwell. I'm doing the head to toe assessment for Nurse 7102. It's October 26th. Dr. Buford is my instructor. Roger Wilson is my patient. We've already signed the consent. Here are all of my supplies. Go around the room. Do the floor. And the ceiling. For patient privacy, we have already assessed his anterior and posterior torso. We're going to start by assessing the patient's skin. We're going to look at the face, head, neck, arms, legs, the entire body. We're going to assess the skin for color, temperature, moisture, skin turgor. Going to look for any lesions, bruises, scars, nevi, edema, or redness or nodules. Then we're going to move to the head. We're going to make sure it is midline and symmetric. Going to move to the scalp. Make sure there are no infestations. The hair is equally distributed. Hair color, hair texture is normal. We're going to make sure there's no tenderness, lesions, indentations. Then we're going to move to his face. We're going to test, no, going to move to the glands, lymph nodes. Going to assess the occipital, the preauricular, postauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and subclavicular. No abnormalities noted. Trigeminal nerve, the cranial nerve number 5. To assess that, we ask the patient to clench their jaw while we palpate the masseter muscle. Cranial nerve 5 is intact. The sensory part of cranial nerve 5 is light touch. Close your eyes, please, and tell me where I touch.
Right cheek, forehead, chin, nose, left cheek.
Cranial nerve number 5 is intact. We're also going to assess for TMJ while we're here. Ask the patient to open their mouth. Do you feel any pain or tenderness?
No.
Feelings for subluxation, crepitus, pain, and tenderness. Then we're going to move to the patient's eyes. We're going to look at the eyebrows, eyelashes, and palpable fissures. Then we're also going to assess the conjunctiva and the sclera. Look up for me. Going to make sure there's no lesions, drainage, or redness. Then we're going to assess his field of vision. This is the optic nerve, cranial nerve number 2. Cover one eye and read the lowest line you can cover. Read for me.
LTF PH.
Cover the other eye. Read the lowest line you can read.
LTF PH.
Vision is 20/20. We're also going to assess peripheral vision, part of cranial nerve number 2. Tell me when you can cover the same eye, and tell me when you can see my fingers. Okay.
See it.
Then we're going to move. Then we're going to move on to cranial nerve number 3, which is the oculomotor nerve. For that, we're going to use the pen light. We're going to test direct consensual reaction to light. Pupils are equal, round, reactive to light, and accommodate. Going to test accommodation and convergence. Follow the pen light. Then we're going to test cranial nerves 3, 4, and 6, which is the optic nerve, the oculomotor nerve, the trochlear nerve, and the abducens nerve. For this, we're going to assess all the 6 cardinal fields of gaze and extraocular movements. Follow the pin light. Cranial nerve number 3, 4, and 6 are intact. Then we're going to use the ophthalmoscope to assess red light reaction and the parts of the eye. The internal eye structures. Then we're going to move to the ears. We're going to assess them for symmetry and position. We're going to assess the outside of the ears. We're going to palpate the pinnae and the tragus, make sure there's no tenderness or masses. We're going to use your ophthalmoscope to assess the tympanic membrane and the ear canal. Pearly gray. Ear canal is clear. Tympanic membranes, pearly gray. Ear canal is clear. Then we're going to assess cranial nerve number 8, which is the acoustic nerve. We're going to do this Weber test first, checking for lateralization. Tell me if you hear it equally on both sides, or you feel it equally on both sides.
Yeah.
That's the Weber test. Then we're going to do the whisper test. Repeat after me. ABC.
ABC.
1, 2, 3.
1, 2, 3.
Then we're going to do the Rene test. I'm going to hold this to your master bone behind your ear, and you're going to tell me when you hear it stop. Okay.
Yes. Yes.
All right. And we'll do the other side.
Yes. Yes.
Bone conduction did last longer than air conduction, which is appropriate. Then we're going to assess the nose. We're going to assess for midline, test nasal patency. Going to close your eyes, and you're going to tell me what you smell. I'm going to hold one side of your nose.
Rubbing alcohol. Rubbing alcohol.
Then you're also going to palpate the frontal sinuses and maxillary sinuses for tenderness. Then we're going to assess the mouth. When you look at the mouth, you're going to be looking at lips, teeth, gums, tongue, buccal mucosa, the floor of the mouth, the posterior pharynx, and tonsils and salivary ducts. When you assess the mouth, the cranial nerve number 9 and 10, cranial nerve number 9 is the glossopharyngeal nerve, and number 10 is the vagus nerve. To assess them, you're going to ask the patient to say ah, and you're going to watch, then make sure the uvula and the soft palate all rise together and symmetrically. And then you can also ask the patient to stick out their tongue to test cranial nerve number 12. That's the hypoglossal nerve, and be sure there's no folliculations in the tongue. Okay. Open your mouth, please. Stick out your tongue. Say ah. Cranial nerve 9 and 10 are intact. Stick out your tongue. Raise it. Left, right. No folliculations in the tongue. Cranial nerve 12 is also intact. Next, we're going to assess the neck. Going to palpate the trachea and the thyroid, and to make sure there are no nodules or swelling. Swallow. All right, turn your head to the right and swallow. Turn your head to the left and swallow. There were no abnormalities noted. You're also going to palpate the carotid arteries while you're here. Two plus and regular. You're also going to listen for bruits while you're here with the bell. Hold your breath. Hold your breath. Then we're going to move to the patient's respiratory system. We're going to observe the patient and make sure there are no signs of respiratory distress. There's no tachypnea, no cyanosis, no nasal flaring, no muscle, no retractions, no. You're going to feel for tactile phremesis. Take a deep breath. Take a deep breath. Take a deep breath. You're going to observe for deformities. Make sure the chest expands symmetrically. Actually, turn around for me, please. Going to ask the patient to take deep breaths. Deep breath in. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And deep breath. Then you're going to listen for egophony. Say E.
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 E. E. E. E. E. E. E. E.
Bronchophony. 99.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Whisper pectoriloquy. You're going to whisper 99. You're going to palpate for tactile phremesis. Deep breath. Deep breath. Deep breath. You're going to percuss all the intercostal spaces for each lobe. You're going to want to feel dullness, hear dullness. While you're here, it says for CVA tenderness. Tenderness. All right, you can turn back around for me. Then assess the anterior chest.
Go, lay down.
Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. Then we're going to listen to heart sounds. The aortic valve is the right sternal border, second intercostal space. Pulmonic is the left sternal border, second intercostal space. Herb's point, left sternal border, right intercostal space. Tricuspid, left sternal border, fourth intercostal space. Mitral, midclavicular line, fifth intercostal space. This is also your point of maximal impulse. You're going to listen to the apical pulse for 1 minute while you're here, and then you're going to palpate for the PMI. And you're going to listen to all those points with your bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. You're going to ask the patient to lay down. I have 2 patients.
Lay down. Go.
Lay down. Lay down, Rocco. Go get in your bed. You want the head of the bed to be 30 to 45 degrees. You're going to assess for JVD. Jugular vein distension, there is none noted. You're going to listen to all the heart sounds with the patient in supine position. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Done with the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Then you're going to listen for bruits with the bell. Aorta, renal arteries, no bruit. Renal artery, no bruit. Iliac artery, no bruit. Iliac artery, no bruit. Femoral artery, no bruit. Femoral artery, no bruit. Then you're going to listen to all quadrants of the abdomen. Before you begin your abdominal assessment, you're going to assess for the abdomen for contour, shape, size, and any deformities. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. You would ideally listen for a minimum of 2 minutes, maximum of 5 minutes if you have hypoactive bowel sounds. Then we're going to percuss for dullness, tympany, and flatness, all 4 quadrants. Then you're going to percuss over the liver and spleen. You should have tympany in all of your areas that are air-filled, dullness over the liver and the spleen. Then you're going to palpate all 4 quadrants, looking for masses of tenderness. Then you're going to palpate for the liver and the spleen. Okay, you can sit back up. Now we're going to move to the musculoskeletal system. When you start, you're going to check out going to assess the joints of the hands, wrists, shoulders, elbows, toes, ankles, knees, and hips for any redness, crepitus, deformities, symmetry, nodules, or swelling. And you're also going to assess the skin of all the limbs. Going to assess capillary refill, greater than 3, less than 3. Capillary refill is good, less than 3. Going to do pulses. Going to assess the temporal pulse, radial pulses, 2 and equal, dorsalis pedis pulses, 2 and equal, posterior tibialis pulses, 2 and equal. We're also going to assess reflexes, bronchoradial, brachial, bronchoradial, brachial, I said those wrong. These are reflexes. This is the bicep, the tricep, bronchoradial, bronchoradial, bicep, triceps, patellar, sorry, patellar, Achilles, and the Babinski reflex. Going to go ahead and assess grip and strength. Squeeze my fingers. 5 of 5. Going to pull and push. Biceps, strength, pull. Triceps, strength, push. Shrug your shoulders. Cranial nerve number 11. Sensory nerve, or accessory, spinal accessory nerve. Then you're going to, this is plantar flexion. You're going to push down. Dorsiflexion, pull up. 5 of 5. Push against me. Extension, hold on. This is extension, push against me. And flexion, pull. This is knee strength. And then we're going to abduct for hip strength, push out, push against me. And adduction, push in for strength. 5 of 5. Going to assess range of motion in all of our joints. Flexion, extension, hyperextension, radial deviation, ulnar deviation, rotation, thumb opposition. And then the wrist is rotation, flexion, extension, hyperextension, rotation. Elbow, flexion, extension, hyperextension. And then shoulders, flexion, extension, hyperextension, adduction. Sorry, this is abduction, adduction, circumflexion, and then internal rotation, and the other side, internal and external rotation. And then we're going to test for cerebral coordination. Flap your hands back and forth for me. And then touch your nose with your right hand and touch your nose. And then touch my finger with your left hand and touch your nose. And then go back one more time. Okay. Then we are going to move to the toes. We're going to flex, extend, and I'm doing it backwards. I'm sorry. Flex, extend, hyperextend, abduction, adduction, and then on your ankles, you're gonna inversion, rotation. Then knees, flexion, extension, hyperextension, flexion, extension, hyperextension, and hips, flexion, extension, hyperextension, adduction, abduction, circumduction. And another one. Flexion, extension, hyperextension, abduction, adduction, circumduction. I'm going to test his gait. Going to walk forward. And then heel toe. Back up. All right. And then hop on one foot. Hop on the other foot. Okay. Then we're going to assess your spine. You can turn to the side for me. Going to assess for any abnormalities. Do you have any, ask the patient if they have any pain. Bend over at the waist. Okay. Flexion, then stand up straight. Extension, and lean back. Hyperextension, and then turn towards the camera. I'm going to go turn all the way. Lateralization and lateralization. And rotation. And then we're going to do your neck. Flexion, extension, hyperextension, and rotate left and rotate right. And did I say it backwards? I'm sorry. I'm sorry. And then the Romberg sign, you're going to cross your arms across your chest and close your eyes and see if we have any dizziness or balance issues. Romberg sign is negative. Okay. I think that I'm done. Thank you.